Hello everyone, thanks so much for joining me today. My name is Lydia and this is Time with Lydia the Pharmacist. If you're new to this channel, a warm welcome to you, and to all our returning subscribers, thank you once again for joining me. You know, our community is growing. We have reached 1K subscribers, and I just want to take this opportunity to say a big thank you to you all. You have been so supportive throughout this period, and I really appreciate it. Today, we are going to be talking about something really exciting. And if you haven't yet seen my video on heart attack, please do check it out, because then it will make you appreciate this topic a lot more. So, we're going to be talking about how to do a cardiopulmonary resuscitation, or a CPR for short, step by step. This is a process that if you know how to carry out, you would be able to save a life. This process is a life-saving medical procedure which is given to someone who is in cardiac arrest. It helps to pump blood around the person's body when their heart can't. If you are a witness to a cardiac arrest, the first thing you need to do is shake and shout. If you come across someone who is unconscious, always check for danger and look for risk before you start helping. Someone having a cardiac arrest will either not be breathing or they won't be breathing normally. They also won't be conscious. Check for a response. Gently shake the person's shoulders and ask loudly, "Are you all right?" Then shout for help. If someone is nearby, ask them to stay, as you might need them. If you're alone, shout loudly to attract attention, but don't leave the person. The second step is to call for emergency medical help. If you're in the UK, the number is 999. And wherever you are, I'm sure there are emergency services available. If the person is not breathing, then you need to call immediately. The third step is to cover the mouth and nose with a cloth. This is a step that has been introduced recently because of the COVID-19 pandemic, and is to ensure that you are safe and the person is safe. If you think there's a risk of infection, then you need to lay a towel or a piece of cloth over the person's mouth. If you're sure the person is breathing normally, then put them in the recovery position. Step 4, give chest compressions. Do not give rescue breaths at this time. Kneel next to the person. Place the heel of one hand in the center of their chest. Place your other hand on top of the first. Interlock your fingers. With straight arms, use the heel of one hand to push the breastbone down firmly and smoothly so that the chest is pressed down between 5 to 6 centimeters, and then release. Do this at a rate of 100 to 120 chest compressions per minute. That is around 2 per second. This means that it's got to be really fast. Number 5, keep going. Keep going until professional help arrives and takes over, or the person starts to show signs of regaining consciousness, such as coughing, opening their eyes, speaking, or breathing normally. If you're feeling tired and there's someone nearby to help, instruct them to continue. After CPR personal care, after the ambulance crew have taken over, wash your hands thoroughly with soap and water, or use an alcohol-based hand gel. After you've done CPR or witnessed a cardiac arrest, it can be emotionally challenging and traumatic. Even medical professionals with years of training can be affected. This is understandable, and it's important that you ask for help from healthcare professionals or from family and friends if you feel the need to do so. Thank you so much for your time today. I hope you have learned something new. Please give this video a thumbs up. Share with family and friends. Leave your comments and your questions in the comment section. If you haven't yet subscribed to this channel, please do hit on that subscribe button and also on the bell so you don't miss any video that I upload. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.